Buonasera a tutti, good evening. My name is Corrado Paina, and I'm the Executive Director of the Italian Chamber of Commerce of Ontario, Canada. Welcome and thank you for joining us today for the second webinar organized by ICCO Canada in partnership with AIRI, International Association of Italian Researchers, and Sistema Italia, Embassy of Italy to Canada, Consulate General of Italy in Toronto, Italian Trade Agency, Istituto Italiano di Cultura, and Italian National Tourist Board. I've seen things people won't believe. Attack ships on fire off the shoulders of Orion. I watched sea beams glitter in the dark. Tonight, we will talk about artificial intelligence, a very current topic, as technology progress in this field is increasing, and the acceleration in its adoption in business and medical research is becoming now a reality. The interaction with humans and machine is a very fascinating theme. We will discover, thanks to the contribute of our speaker, the application of this technology in the neuroscience field and in something very common to all of us, the customer care experience. On April 15, 2021, we celebrated Italian Research Day in the World 2021. Italy is a driving force in the field of science, technology, and innovation. As part of the Italian promotion activity abroad, and with reference to initiatives and information events on science, research, and innovation, the Italian Embassy in Canada is supporting several projects, including this lecture. We have a message now from Andrea Ferrari, designated Ambassador of Italy to Canada. Please, let's watch.
Good evening and welcome to this event on artificial intelligence and neuroscience. The experts who will speak today, whom I would like to thank for their participation, will highlight some of the main applications of this technology, which will be key in the coming years in any aspect of our daily life. The webinar will focus in particular on two main areas of application: the protection of human health and the efficiency of the production chains, where the artificial intelligence is already showing its huge potential. In the world we live in today, and more importantly in that of our children, concepts like big data analysis, the Internet of Things, or automated supply chains will be increasingly present and will help us in finding new and smart solutions to improve our well-being as well as to build a sustainable economic system. In these uncertain times, when these promising technologies are still in their infancy, our task is therefore to mark the trails to be explored to direct this powerful tool towards the construction of a more efficient, cleaner, and healthy world. Raising awareness on artificial intelligence and envisaging its most useful and ethical applications is a duty for us all. Hoping that today's event could put the spotlights on what we should expect from our future, I want to thank once again you all for your participation, and I wish you a pleasant webinar.
Ambassador Ferrari, thank you very much. Back now to our today's webinar, and please allow me to welcome our guest, Dr. Paolo Bazzigaluppi, PhD in Neuroscience from the Erasmus University, Rotterdam. His academic research is focused on the biological origin of neurodegenerative disorders. Currently, Dr. Bazzigaluppi collaborates with public and private research institutions engaged in neuroscientific research. Dr. Mario Zucca, MSc in Electronic Engineering and PhD in Economics, is specialized in the design and development of innovative high-tech software products. Now I leave the floor to Dr. Emilia Luca, PhD Research Associate at Sunnybrook Research Institute, for a brief introduction of AIRI Cerca. Emilia.
Good evening, everyone. I'm Emilia Luca, main referent of ICCO Toronto chapter. Before presenting our association, we would like to thank you, the ICCO Canada, for organizing these scientific lectures and today's sponsor, in particular, the Embassy of Italy in Canada. ICCO is one of the largest association not-for-profit. ICCO is the International Association of Italian Researchers, is a not-for-profit association and is one of the largest scientific Italian communities in the world. We are more than 25,000 researchers and we have 7 chapters in different countries. Our mission is to promote scientific collaborations, exchange of professional information, and cultivate the role of scientists in popular science. We know science. We do science and we want to communicate it clearly and effectively to the public. If you would like to know more about ICCO, follow us on social media. It's now the time to give the floor to Dr. Paolo Bazzigaluppi, who will explain to us the important applications of AI in the healthcare sectors. Thank you for your attention and enjoy today's science talks.
Thank you, Emilia, for the kind introduction, and good evening, everyone. So I would like to start off my presentation by thanking ICCO Canada team and the Italian Embassy of Canada, who gave us the opportunity to be here tonight. My name is Paolo Bazzigaluppi, and in this talk we will quickly give an overview of artificial intelligence and the opportunities that it offers in the field of neuroscience. In general terms, artificial intelligence is a technology which enables a machine to simulate human behavior. The aim of this technology is to create machines who can replicate parts of human behavior independently, which means that a machine can learn from previous experience and improve their performance during future presentation of the same or very similar tasks. In the beginning, artificial intelligence was a relatively small field, and it mainly attracted the attention of mathematicians, statisticians, computer scientists. But during the early 2000s, it started resonating also in the medical community. Early medical artificial intelligence systems relied heavily on medical domain experts. They were very labor-intense and difficult to update. However, in the late 2000s and in the late 90s and early 2000s, a new generation of more advanced machine learning system emerged, and these systems were capable of training themselves to learn the rules directly from the data, such as unstructured tests from medical records and images. These systems were also slow in adoption in the medical field, largely due to the fact that there were limited freely available data in the internet, and they required a very advanced domain knowledge and expertise, both in the medical as well as in the engineering fields. The situation, however, is changing recently because of the hardware improvements that made hardware and software system more intuitive and easy to work with, and increased availability of medical data. Machine learning is a subset of artificial intelligence, which allows a machine, basically, as I was saying before, to automatically learn from past data without explicit instructions. Over the last decade, a series of different machine learning algorithms were developed. The first generation of this machine learning algorithm belonged to the family of supervised learning. In this kind of algorithm, the supervision consisted in feeding the system a large number of objects, for example, pictures of neurons, and labels, which would be the text word neuron. And using these two information, the system could learn the basic characteristics of neurons and learn which set of features were to be associated with the word neurons and which ones were not. The timeline of machine learning and basically how early implementation of artificial intelligence were especially used and were belonging to a niche of scientists in the mathematics and statistical field, whereas more recent developments of these algorithms became more largely available due to the newest generation called deep learning and unsupervised learning, which were easily adopted because of the largest availability of data and more user-friendly and more powerful hardware systems. We were then proceeding to this slide where I was just outlining the key difference between supervised learning and unsupervised learning. Supervised learning is basically generation of an early implementation of machine learning algorithm that required a lot of human supervision that basically was providing machines a set of data as images and a set of labels. And algorithms were capable of extracting the key features from images and understand which one of these features were to be associated with the label neuron, for example. The later generation, unsupervised learning, something like deep learning, and the more evolved algorithm machine learning, on the other hand, did not require such labeling effort, which requires a lot of human power and human efforts. So one of the most common type of supervised learning, deep learning, is becoming widely used because it does not, as we were saying before, require human label data. It achieves high accuracy, and it can deal with databases containing different types of data. In the field of healthcare, and particularly neuroscience, this type of approaches are being increasingly adopted, where there are large amounts of data of different types that are collected over a long period of time, and they would require extensive human power to be analyzed. One of the fields in neuroscience where there is more and more need for this type of approaches is, for example, clinical trials. So clinical trials are particularly expensive in neuroscience and for the development of drugs for neurodegenerative disorders, because the process is particularly long. It takes up to 13 years. And it also costs up to 5 to 6 billion US dollars. And interestingly, the half of the process is normally spent in the phase 2 and phase 3 clinical trial. This basically is a point where artificial intelligence can play a big role, and is being largely adopted because of its promise of being able to sort of optimize this process. Despite all the effort, the majority of clinical trials are largely unsuccessful, and the key factors causing a clinical trial to be unsuccessful are normally the way in which the patient's cohort is selected, and the recruiting mechanism, and the lack of a reliable and efficient system for patient monitoring. Of these three issues, we will focus only on the first one, so the cohort composition, on this webinar. So the problem with the cohort composition is that it is important to notice that clinical trials do not aim to demonstrate the effect of a drug in the general population. What they do is that they prospectively select a subset of the population in which the effect of the drug, if present, can be more demonstrated more easily. For example, consider that neurodegenerative disorders afflict the more senior individuals of the population, and therefore a clinical trial aimed to confirm the effects of medication to treat dementia, for example, will most likely include senior individuals and will not include junior and young part of the population. However, not all the characteristics of the patients are easily accessible as their ages. And unfortunately, the hard to assess information about patients' health may play a very important role in measuring the effect of a therapy. Therefore, enrolling unsuitable patients in a clinical trial simply increases the likelihood of clinical trial failures. So one of the aims in the machine learning field is to create algorithms that integrate different types of information. For example, the quantity and type of calorie intake, physical activity, habits, family medical history, electronic medical records, and so on and so forth. And once they integrate all these information, they can identify the subjects that might confound the result of the clinical study. This is a very ambitious goal due to the size, the complexity, and the variety of the data, and it requires a very specialized IT infrastructure and software solution. At MSSL, we are working on a system, for example, that allows to combine different information from every patient and to be able to identify those patients who are not suitable for the study. For example, because of underlying condition or habits that might jeopardize the outcome measure of the study. This step is called cohort stratification, and is of great interest due to the promise that it has to shorten the time of clinical trial and reduce costs for the development of new therapeutic approaches. But there are many questions at this point. So one of the key and most important question is, what are these information? So where does this information come from? When we talk about wearables and digital biomarkers, these are basically the source of the information that in the future we hope will be those that will, the type of information that will be used to run diagnostic tests, as well as will help scientists and researchers to predict the compliance and the faith of patients in clinical trials. This is because over the last decade, the accuracy of sensors embedded in personal electronic devices has increased significantly, and some of them can now reliably measure vital signs like heart rate, skin conductance, eye movement, body temperature, gait imbalance, and many more. The problem, however, with the collection of this data is not just the measuring and assessment of the biological signal, is also down the road when all this system, all this data streams that represent different things have to be integrated and analyzed. For this case, one of the most recent and most interesting approaches was demonstrated basically by Roche in 2018, where they basically pioneered one of the first use of electronic devices for the detection of neurological condition. So what Roche did, they ran a 6-month study during which 44 Parkinson's disease patients at different stages of the disease and 35 age-matched healthy control were monitored for 7 hours a day using a commercially available smartphone, which mounted a proprietary app. The phone sensor were controlled by the app, and they were basically running selective tests. So they were asking 6 questions every day to the users. Very simple question and very simple task like sustained phonation, rest tremor, which means that the user was supposed to just sit still with the phone on his lap or sit still with his phone in his hands, and very simple tasks like that. And alongside, they were also monitoring the subject passively, which means that subjects simply had to hold the phone in their pocket and live their daily life. Interestingly, the outcome of the study was that all active and passive features significantly differentiated PD patients from controls, which means that using simply the sensor mounted on a smartphone, they were able to divide, and they were able to basically detect the hallmarks of the behavioral manifestation of Parkinson's disease. Interestingly, a version of the app is currently being tested, and this demonstrates essentially there's a very active field of research with many stakeholders that are interested in the success of this type of study. To summarize, in conclusions, the clinical trials are very long and expensive, also because of the large variability in the patient's population data. Over the last decade, technological improvement allowed to track and monitor human behavior and health indicators with increasing precision and accuracy. And this generates basically a large stream of data that can be analyzed to extract meaningful information about the healthcare and the health of the patients, but it requires custom-built IT solutions. And with this slide, I conclude my presentation. I thank you all for the attention. Apologies for the initial glitch and bump in the road, and I can take any questions now.
Thank you, Paolo, for your presentation. There is a question, what are fields beside healthcare could benefit from collecting all this information about people's health?
Yeah, so thank you for the question. There are many fields that are potentially affected by and could potentially leverage this technology. This technology is commonly known as basically digital phenotyping, which was a term that was first used maybe 15 years ago in the context of, again, digital health. But after that, many more stakeholders are being interested and are investing energies and time into trying to characterize, measure, and describe human behavior, basically for commercial purposes, because you can basically think about how much this information that can be acquired by mobile devices and personal electronics can tell a lot of things about people, about their habits, how they behave, and what they prefer buying, for example, where they prefer to go. So there's a lot of parallel interest, parallel to the healthcare sector of people that are interested in this type of data.
Okay, thank you. There are other questions coming, but maybe now I will pass the floor to Dr. Mario Zucca, and after you can take the other question. Dr. Mario Zucca will give us an insight into artificial intelligence for business. Please.
Thank you, Emilia. Thank you to all to be here tonight. And just a moment to start my presentation and to start my sharing. Okay, now it's time to talk about chatbot and about the virtual agent. We don't go into too many details, technical details, and we focus more on a business perspective of this kind of technology. We want to talk about chatbots, or also named digital agents. But before entering why they do the things, why they adopted that kind of technology, I prefer to start asking why we have to talk about chatbots. And let's start with the problems. Unlike in the past, today, it is the customers that dictate the rules to interacting with businesses. Previously, the companies imposed contact points, mainly contact center, on customers who had to adapt to obtain the requested information. On the contrary, today, the customers dictate the rules, and the recent advances in technology allow us to keep up with the times. So thanks to the technology, the evolution of the technology, that we can now use this kind of product, and we can employ that in our companies. Because no matter how big or famous any company has to respond quickly and appropriately to customers' requests, in this kind of digital era, it's very important to acquire a competitive advantage and using the digital experience all around the company. But what are the major pains we are experiencing today using the current app or internet or any kind of technology, old style of technology? The main problems with any site or app that any of us have used over time is that they aren't that simple. After all, what could be simpler than interacting using our voice? We were taught since the childhood to asking for information, and the critical point is precise is the verb to ask. Through the voice, we can have direct information, simplify access to information, and understand the tones and the nuances of words. In this way, we can have a more straightforward communication. My personal point of view is that the navigation in the site is very complicated and not so simple. And also the information can be very difficult to retrieve. So we need to experience a new kind of technology to simplify this access to the technology. But what are these kind of technology, and what's it based on? Because we are using the voice to communicate each other, but currently, the most used way of communication is through messages. And if we look at the current use of the mobile phone, we can see how its use has evolved over the years. From the simple voice communication tool, it has become an irreplaceable daily companion for work and leisure. It is impressive to note that among the dozens of applications installed, the ones used are very few. The main application involves sending messages. Social network, friends, work colleagues are the daily recipients of billions of messages. The numbers are very impressive and are growing day on day. These tools are cleared through customs and asynchronous mode of communication that radically changes our traditional way of communicating. An asynchronous mode is far more efficient and less invasive, and it's hard to think you can go back. And more users in the corporate world consider that more than 1 billion messages are related to business, and that about 33% of these are used to order or buy a product. And these are statistics I took from a research published from Facebook in 2016. I think the current numbers are 3x, the one shown there. But the consumer receive ongoing information through any kind of social media, influencer, any type, and they have day by day less time to communicate and search for more specific answer. So the companies need to be present and reactive, looking at all the possible touch points on the customer journey. Before the digital era, the company was the first touch point to obtain the information about the product. But currently, there are many ways to get information about a product, a company, or services, and mainly are based on social media. So we have now the post-digital era. We can see that only the 2.4% of the customers looks for a direct contact with the company, but we usually prefer inform ourselves using the new media channels. And also here the number published from Harvard Business Review in 2019, the 90% of the customer does not decide which brand to buy without looking online sources. So it's becoming crucial to get the information as fast as we can. And the chatbot, we can think the chatbot as the natural response to these market trends. We can now understand the reason that led the bots to have this market success. Just think that according to the latest surveys, there are over 2 billion smart speakers in the world, and they exchange over 20 billion messages a day with them. But what is the technology behind it? What were the technology leaps that allowed us to get to this point? You heard in the previous presentation the importance of artificial intelligence in general in the field of medicine. Here we can say then, even in linguistics, artificial intelligence has made a fundamental contribution. In particular, modern NLP techniques have developed the ability to represent words as numerical vectors. This mathematical representation of terms made it possible to apply the same deep learning techniques to the written text. This allowed for a quantum leap in the software ability to understand and even create written text. But what exactly are the chatbots are, and how can they be used? Essentially, a chatbot is a software based on artificial intelligence to simplify and automate all the regular and transactional processes. If we suppose that we can understand a user's request, we can then write software that can satisfy this request by exploiting the enormous potential of modern computers, and in particular of the cloud. Think about the evolution of Google and how it can now answer an astonishing number of questions in almost any language in the world. Think about the potential that this technology has brought and still can bring to companies. The applications are virtually infinite. If we think about Google, we can see that in the last years it has evolved, and in the first version of this software, we ask a question, and Google responds with a lot of links to articles that we can expect to find the answer to our questions. But now it is able to express directly the answer, and very often the answer is really correct. So what are the opportunities for the bot? We can think the bot as the answer to two different needs. The one strategic and another one for operational efficiency. The strategic point of view, we can say that we can establish with the bot a direct relationship and the personal between customer and the company. And from the operational efficiency, we can increment the productivity because in the asynchronous way, and we can send a message, the bot find a way to respond directly to the customer. And we can reduce also the cost, internal cost, driving us through an operational efficiency. In the last 2 years, we worked with a lot of bots, for big companies like Vodafone or Enel, one of the biggest energy company here in Italy, but also for no-profit organization and for some of the biggest university here in Italy. And currently, the technology can handle not just written text, but also spoken text, because we can, with evolution, the growth in the power for the computer give us the ability to talk to a bot, and the software can translate the frequency, the words we are speaking into numbers and translate in text. So the bot can bring the text and find out what the customer are asking. So we finished this short presentation. If you have any questions, you are more than welcome.
There is actually a question. Will this technology take away jobs?
This is a great question. I think that I hear that question, I think, a million of times. And it depends the point of view. If we're looking at this problem, from some job, I think they take away some jobs, because if you think the operators in the call center, I think they can be substituted by the bot. But however, there also create new jobs in the high-level field of instruction, education, because there are people that need to instruct the computer to tell what to do. And there is a quote from Mark Anderson, one of the big, a serial tech entrepreneur in the Silicon Valley. He said that there are two kinds of jobs in the future. The one who tell the computer what to do, and the other one will be told by the computer what to do.
Great. Fair enough. There are other questions coming. I guess this maybe it's for Dr. Zucca, but also Paolo, feel free to join. So an attendee is asking, how much money do Italy and Canada invest in artificial intelligence? Are either Italy or Canada leaders in AI worldwide? And if so, can you elaborate on that? Thank you.
I actually don't know exactly the Canada, because I'm living here in Italy. Sometimes I move in USA, and I have some colleagues and also my brother living in New York. And I can compare the investments and between Italy and the United States, but the numbers are so different. There are a lot of investments currently in Italy. I worked a lot with some researcher in the past, and I think that the natural language processing is based mainly on the research on the big companies like Google or Amazon, and also Microsoft. Here in Italy, we figure out how to adopt this kind of technology with the nuances of the different language, the Italian, that is a very small language, and there is not so much interest for the big company to develop this technique for the language. But actually, I don't know so much about the Canada and investments in Canada.
Is the government supporting this in Italy?
Sorry?
do you know if the government, the Italian government, is supporting any kind of these projects?
Actually, not directly the government, maybe the European Unity, the Communion, the EU. EU funds many projects on artificial intelligence. They also launched a new project named Gaia X. It's a kind of cloud provider with it's the base because we cannot handle big data. There is no artificial intelligence. So we can think the big data as a precursor of the artificial intelligence. But there also, I think there is a line of investment very big here in Europe about the privacy. And because there are two main pillars behind the artificial intelligence, the Europeans are most concerned about privacy and also explainability of the artificial intelligence. And there are two quite new topics in the research right now.
Actually, we have a number. Dr. Marignani is saying Canadian government invested more than 750 million in 2016. These monies are administered through NSERC and CIHR, that is the Canadian Institute for Health Research. There is another question for Paolo. Just 1 second, that a lot of questions are coming and I guess I missed it. Yeah, I would like to understand how the first speaker's model could be applied to the COVID experimental drug, as it was approved very quickly.
Yeah, so thanks for the question. I guess that's a hard one, as I'm not a specialist in immunology, so that is outside my field of expertise. What I can comment on is that the early stage, so the early phase of drug development, which is common to many type of drugs, which is basically finding a molecule that is a good candidate to become a therapeutic for human use. That is probably a field where during the R&D, so during the research or development, there was abundant use of AI for the design of molecules. But when it comes to the clinical trial, for immunologies and more specifically for vaccine, not sure how those work. Like the fact that they were so approved faster than many other vaccines, probably the cause of that has to be searched in the fact that the speed at which the disease was spreading. But that is, as I was saying before, outside of my field, so I don't feel confident enough about commenting on the specific clinical trial for the COVID-19 vaccine.
And Paolo, I guess there is another question for you. What are some of, but also Dr. Mario, please feel free to answer as well. What are some of the ethical issues with using AI in healthcare, and how are they being addressed in current trials?
Yes, that is a very good point. So there are many ethical concerns at many levels. One level is, what are you going to do with all this very specific data that basically allow the person who owns the data to derive the identity of the person that is being assessed, so to say. So so far it has been assessed simply by allowing companies like pharmaceutical companies and hospitals who are running a research project to basically outline a contract with the patients and limit the acquisition of the data only during the span of the clinical trial, such that there's an informed content. So the patients know that their data has been acquired, they know that it's being stored and know what it's being used for that specific duration of time. Of course, there are many concerns of what's going to happen when this data becomes like more widely and generally available. And that is a topic that is at the center of many discussions, but to date, as I'm aware of, it hasn't been reached a solution yet. I don't know if Mario and Dr. Zucca has his point on this, his take on this issue.
Yes, I worked a lot of time with in the healthcare, and I worked on a product that was able to predict the nephrology when a patient needs dialysis. And there is a very ethical problem. And if you have the data, the information that you can predict a kind of disease, if you have to communicate this kind of information to the patient, there are many implications of this information. Some in this about economics, and because there is some kind of information that maybe insurance would have, but maybe it's not so fair to give them. Another one, if a disease is curable or not, because if it's not curable, I think it's better not saying anything to the people. But I think it's a point open to debate right now.
Actually, there is another question just on this, and this person is asking, this technology could improve the quality of life for people with all forms of neurological disorders? And if so, how and when?
Exactly.
Yeah.
So it's hard to tell.
Absolutely.
Maria, there is another question for you. And no, sorry, there is another one. It is complex to set up such a system as a bot system.
It depends. And I think with the advance of the technology, and I worked in the last time with some Amazon products, and I think they are very, very easy. In the past, I worked mainly with the Microsoft software, and it's been quite complicated to install and to train. And currently, using the Amazon the AWS technology, we can set up about in, I think, 2 hours, 5 hours. In the first proof of concept to have a workable bot. I think maybe 1 week or 2 weeks of work, so we can have a very simple working bot.
Thank you. There is another question for Paolo. What impact does the creation of large data sets have for society at large?
Yeah, so the creation of these large databases is also connected to the topic we were talking about earlier. So one of the basically the dreamland of this would be can be considered personalized therapy. So the fact of having all this information about people will allow essentially to design better treatment, but also to administer at a better timing and with a better and more efficient dosage already existing approaches. And that would be made available by knowing a lot of things and a lot of information about the healthcare status of every patient. On the other hand, it raises, especially at the early stage of adoption of this technology, as well as the early stage of adoption of any technology, it always creates a question about, social justice, like who should be served by this technology first, because normally at the early stage they are more expensive, they're very elitary, so who should have access to these technologies first, who should have the advantage, and also more importantly, who should handle the keys to all this information that are very important and supposed to be private. Who should handle them? How should this be handled? What are the security levels that should be adopted, and so on. So there are many implications, not just from the IT perspective, but also from ethical perspective that needs to be tackled before this technology gets deployed in the population.
Well, another question for you. Does AI recognize and correct obsolescent information? I guess the question is alone, or you need the training.
Yeah, this is a very technical question. I would like to have also the third take on this. My instinct would be that AI algorithms are very sensitive to the initial bias. So what is right and what is wrong basically gets determined by how the algorithm is being trained. So in principle, yes, they can detect data that is getting obsolete or it's no longer up to date. but it will need to be trained accordingly. So trained to be able to detect this kind of information.
Okay, thanks. There is a question for Mario. How can I check the system if there is no human operators?
Oh, okay. That's a very important question, because when a system is not supervised, there is always the problem, the difficult to understand if the system is working well or not, because there is no way to assess this kind of information. And in this field, actually, the AI can help with these kind of problems. And there are also now currently there are tools that can analyze all the questions asked by the customer, all the responses made by the bot, and analyze if there is something wrong or is going all well. And so they can create some reports. The administrator can read to answer this question. But and the technology is improving constantly, because currently these kind of tools can be applied also to human conversation. They can translate in the words or the sounds we are emitting into words, and apply this kind of the same techniques in real time. And in the modern contact center, there are supervisors that can be warned if there is something wrong, and not just in the chat, but also in the conversation, the speaking of the agents and the customers. Quite impressive.
Yeah, I agree, because I have my Alexa, and if I said, Alexa, good night, she will reply me, and kind of weird, but it is true. So we, in some way, hear our conversation, maybe, this information are recorded or not, no idea, but it's kind of, we live with this technology all the day. There is another question for you, Mario, and can a bot interact by phone?
Sure. And now we're using this kind of technology. As I said before, the technology is able to translate in real time the speaking into words, can be understood by the bot, and provide the answer like it was written text. So the answer is yes.
Okay, perfect. I have another question for you. What are the potential risks of aggregating all this information about people's health in a single place?
Yeah, so thanks for this question. So again, this question can be probably answered on a couple of levels. The first is from a probably organizational point of view, as we were discussing earlier. So there should be an interaction between different organizations, like the political level, at the patient associations level, at the customer level. So there should be a discussion about who should own the data, where the ownership is, and where what use of this data can be done and for which purposes. The other level is also matter of security, which is more kind of technical question. So data is always like databases are sensitive to attacks of any sort. So there's also risk related to the fact that there could be intrusions and theft of this type of data. So all this development of technologies goes in parallel with advancement in cybersecurity approaches to keep this type of data and these databases protected. So there's also that risk, that technical risk, due to the fact that people might want to steal and have access. Unauthorized people want to have access to this type of information.
Speaking on cybersecurity, do you know if in the past or haven't happened that it was a ransom attack for obtaining data from artificial collecting this data? Or
I'm not sure about healthcare. I know that they've been way more frequent in the banking sector. Just a year ago, banks in Canada were suffered one or 2 years ago, I don't remember exactly, but banks suffered cyber attacks in which this type of integrated large databases about their clients were hijacked and were extracted, and they worked hard to, of course, patch that. But it is a sensitive topic, so there's also that level of security that needs to be kept in mind, not just the use and the purpose of this data, but also the technical defenses against malwares and badly intentioned people.
There is a following question on this. The attendee is asking who will be responsible or the guardian of all this data collected, and which country will be keeping the data bank?
It's a good question. Again, hard to say. Should the person who generates, should the subject own the data? Should the organization who collected the data own the data? These are all where should the data be stored, in the country where the person resides, or where the study took place, or where the founders are headquartered. These are all good points. There is, to my knowledge, not a clear and a clear-cut answer yet. All this technology are ramping up as we speak. So there is no, as far as I know, the US is very strict and sort of conservative approach, as in US data has to be stored in the US, on the US soil, so can be securely stored in US databases like Amazon or Google. But yes, it's a good question, and there is no clear answer right now. I don't know what Dr. Zucca thinks about that.
Mario, do you would like to add something on this?
And this is in Europe, there is a strict regulation because the GDPR, this is the regulation about security in personal information here in Europe, has posed strict rules about where the data must be, and it must be inside the border of the European Union. And in some cases, the nations are imposing more strict rule, and maybe the data cannot leave the border of of a single state. So it depends also on the regulation. And in other countries like China, the data must be accessible from the government, and so there are different different answers to this question depending on the nation, the regulation, and it's very, very important and difficult problems because it poses also some ethical questions.
Thank you, Dr. Zucca and Dr. Paolo Bazzigaluppi. I guess so far we answered all the questions. Someone else have other questions, please feel free to send them to ICCO Canada, and they will forward to the speaker of today's. There is a coming question, maybe 1 second. It's asking for the Belgium, it's working of a giant computer machine to control the world of information. I guess we can open topic like this another time, but could be. I will leave the floor to the closing remarks by Corrado, and thank you again for your attention. I hope you enjoyed these talks. Thank you.
Thank you, Emilia. Thank you very much. Thank you, Dr. Paolo Bazzigaluppi and Dr. Mario Zucca, for giving us an idea of some real-world application of artificial intelligence. It has been so interesting to follow your presentation and discover how this technology will impact more and more our work and the society we live in. A special thanks to the Italian Embassy in Canada and the Sistema Italia for being part of this series of scientific lectures. I take the opportunity to remind you the next appointment on October 6th, focusing on genetic and related diseases. To register to the next class, please check the link in the chat. Finally, thank you again for your attention and curiosity in such a relevant topic. Please, I would like to take a minute to thank the people that made this event possible, the staff of the Chamber, Monica, Ilaria, Mary, thank you very much for your tireless work. And I would like to to us, to the people, to become part of the family of the Chamber. This series of lectures are an attempt from our side to get close to the scientific world. We bring everyday ideas, novelties from the innovation world, and Italy has so much to say in that sense. But we also want you to become part of this network of business, culture, science. The Chamber of Commerce of Ontario, Canada, is a very interesting and challenging place to be today. I also remind to everybody that it's the 60th anniversary. In 1961, the Chamber was created. Thank you again for your patience, and thank you for having been with us this evening. Bye-bye.